We've been hearing this sort of phrase a lot lately.
We will build Canada strong, Canada free, Canada forever.
Canada first, Canada always. We need to opt in for Canada, opt in for made in Canada.
But the focus has been primarily on steel, aluminum, other consumer products. But our guest today says it's time to stamp that Canada first on another essential field, on medical supplies, the needles, the masks, the surgical tools that are critical for frontline healthcare and are increasingly in short supply.
Canada has the highest number of supply disruptions of any country in the world, and they last longer than any country in the world.
That is Anne Snowdon, a nurse and scientist at the University of Windsor. She's been documenting Canada's chaotic and vulnerable medical supply system. Our country spends over $370 billion every year on healthcare, and yet we import the majority of our medical supplies. But Snowdon says no one knows where all those supplies are, in what patients, where they're used, and what would happen if trade wars or a new pandemic cut off their importation. Meanwhile, she says Canadian health teams are struggling with over 3,000 shortages of these critical supplies every year. Here is one harrowing example of a surgeon who found he was missing a key tool for an operation.
The surgeon drove to FedEx because they had the data that says, yes, I have the product right here. The hospital didn't know that, so he got in his car, he drove to FedEx, he picked up the device, drove back, and did the patient's surgery.
Recently, Prime Minister Carney launched a Buy Canada policy. Anne and her colleagues are calling for the same goal in healthcare, tracking products from delivery to patients and promoting Canadian health product producers, using a new tool they've designed to help procurement teams find those made-in-Canada supplies.
The teams that buy these products don't know if Canadian companies exist or not, and they don't really have a way to know that.
Welcome to the Canadian Institute for Health Information podcast. I'm Avis Favreau, the host of this conversation. We're launching a Kai High for Canada series and how health data is at the heart of a great health system. This episode is all about those critical medical tools that frontline workers need every day, a largely invisible supply chain that researchers say needs better data to protect our supplies and to encourage health systems to buy Canadian. And joining us now from Windsor, Ontario is Anne Snowdon. Welcome, Anne.
Thank you so much. I am delighted to be here, Avis.
So in reading the documents that you've been working on and your team's been working on, there was the opening sentence was a bit unsettling in that you talk about the state of healthcare supplies in Canada and you use the word fragile.
What that means is Canada has the highest number of supply disruptions of any country in the world, and they last longer than any country in the world. So fragile meaning the products we need to deliver patient care are not always there for us. That's what fragile means.
And this is the tubing, things you need in ICU, surgery.
The needles we use, the IV tubing, the tubes we use to help people breathe on a ventilator, the medications we need to help people recover from serious illnesses or infections, they are not always available to Canada.
So we don't hear about these as consumers, but are they affecting the healthcare system and maybe even how patients do get care?
Well, there's two things. Consumers often get affected when you go to the pharmacy to fill a prescription your physician has written for you. I would argue that there's a lot of Canadians that are told, oh, that drug is back ordered. You're going to have to wait. The health system does not necessarily know that Anne Snowdon didn't get that prescribed drug because it's back ordered, so it can never track what's the impact of that disruption of a drug for Anne Snowdon's health or Avis or any other Canadian. So that's a bit of a black hole. We don't actually know the outcomes of supply disruptions because we don't track it.
That was one of the really unsettling things about this.
Yes.
Because we're all about data these days. What do you hear from the front lines of physicians, nurses, frontline health workers about how these shortages, and to be clear, you're talking about pharmaceuticals, but also these medical devices that they might need during surgery, right?
Right. So clinicians at the front line look for the products they need to deliver care. They don't have any line of sight as to whether we have those products in stock or not. As a nurse, I often could not find the drugs or the little needles I needed to look after a child. So what would I do? I'd go to every unit that had those and try to find them. And that's what our clinicians do. I spoke to a surgeon last week. He said, Anne, I can't do this surgery unless I have that device. I said, well, what did you do when it wasn't available? He said, they told me it was on order and FedEx was to deliver it. So I called FedEx and drove to the FedEx depot to go and get it.
The doctor drove to FedEx. Is there no agency that's tracking medical devices to make sure everybody has what they think they may need for the next few days?
There is not. Each organization may have some record that those products or that device has been ordered. So they may order them. They have some digital record of the order. We're missing the data infrastructure that tracks a unique product from whoever you ordered it from to where it was delivered and did it actually get used in that patient care. We don't have that record.
So that's part of the research that you've been doing. You were trying to figure out, when we're talking about medical health-related devices, health supplies, where they're coming from. And I think it started with you looking out your window.
I see the shoreline of Michigan right across the window, and the bridge is right over top of my office at the University of Windsor. Yes, and those trucks are massive coming across that bridge constantly.
So where are our medical supplies coming from, and how does that play into your concerns about all of this?
Yeah. Medical products used in care come from all over the world. There's no country in the world that manufactures and can supply every product needed. The fragility part of this is health systems do not have a digital record to know which products come from which jurisdictions and countries, nor do they know how many times and how many patients actually need those products. So if something happened tomorrow where that bridge could not provide capacity for the trucks coming over, about 40% of those trucks, is the estimate, are carrying medical supplies. There's no health system in Canada that knows what supplies are on those trucks so that today, if something were to happen, we would know what we would be short of. That's the problem. You
took a stab at it, trying to look at GPS records, right?
Right.
And so what did you find?
I was able to identify medical products is 40% of what's coming over those trucks. So far, we cannot define those, and we cannot find an agency that knows that and that could say, okay, they're the following products.
So far this year, we've heard the phrase Canada first, Team Canada, because of the new pressures that have changed the game. Has anybody brought up the idea that maybe we need a Canada first strategy in healthcare yet?
I have not seen it, actually.
Do we need it?
Yeah, we absolutely need it. Canada has 10 provinces and 3 territories which independently operate and manage and drive their health systems. Canada, as a country, has very few, it has some, but very few agencies that work with all of those jurisdictions to coordinate and manage a disruption. So if tomorrow we had no product, no particular drug that helps patients during surgery with anesthesia, there's no agency by which that puts everyone at that table to say, who has that product? Who needs that product? How do we get it from where it is today to which patients are most critically at risk if they don't have it? That coordination, that Team Canada approach is missing. And that's what we're moving to try to achieve, some level of coordination across all our jurisdictions. Because what's happened up until now, particularly during COVID and SARS and other events, is we compete with each other. If every one of those hospitals in every one of our provinces and territories are fighting to try to get their hands on that product in short supply from a global supplier, we are not helping each other.
Why didn't we do it after COVID? I mean, it was pretty obvious right after COVID.
That's a great question.
Yeah, okay.
I actually started this after SARS. That was a long time ago. And it didn't happen. I can't explain why it didn't happen. Sometimes I often think about, why can't Canada learn from those extraordinary challenges? I cannot explain this, Avis. If I could, I would. But we are an incredibly talented and a highly educated population. We are not very good at learning from, understanding what we could do better, implementing those strategies to do better into our system so it never happens again.
Where's the resistance? Is it the provinces because they control healthcare services? Where does it fall apart?
We are a very reactive system. We wait for the challenge to show up and then scurry and work very hard to manage it. We are not at all set up to proactively look for what are we likely to see unfold in the next year or 2 years or 5 years and prepare for it. So one of my colleagues said, Anne, we're really good at learning how to fight the war we just fought, not thinking about what's the next one that may be coming online and preparing for it. I don't think it's unique to Canada, but given the lessons we have learned, I think we could do much better.
I'm Avis Favreau, and you're listening to my conversation with Anne Snowdon. After a short break, learn more about the Canada First solution to the fragile state of healthcare supply in our country.
Hi, I'm Kevin O'Keefe, host of Kai-Hi's new webinar series, Beyond the Numbers. Did you know that Canada has some of the richest health data in the world? But every year, we leave almost $10 billion on the table because of missed opportunities to use our data better. Want to know how to cash in? You can register for our live webinar, Wealth of Information, Health Data Economics, on Tuesday, September 23rd from noon to 1 p.m. Eastern, or watch the recording after. All the information is at kaihi.ca. That's CIHI.ca.
I want to talk about what you are saying, let's do Canada first when it comes to healthcare supplies. What does that mean? What's the action plan that you're proposing?
So I am simply proposing a formalized team or agency or organization, whatever that is, that brings all of the stakeholders in health supply chain together to proactively solve the disruptions, the shortages, the challenges health systems experience with so many disruptions, over 3,000 a year. That's like every day, about 10 of them. So how do we work together as a team? Where do we have product today? Who needs it at most, meaning who's at the greatest risk? And how do we make sure the best use of the product we have in hand gets to the people who need it most?
You're talking about an interprovincial cooperation.
Yes.
Who's going to do this?
It's a good question. I get asked that a lot too. We have similar models in place. Canadian Blood Services is a great example. Canadian Blood Services manages all blood products for the entire country. Every jurisdiction is connected and attached to Canadian Blood Services and builds consensus on how do blood products get distributed and how do they make sure every Canadian needs it, regardless of where they live, receives those blood products. It's a similar model to that.
To do that, though, you have to have the data of what's come in
Do we have the data? I've seen when I filmed in ORs that they all have that barcode. Don't they
Yes.
use that barcode so everybody knows where everything is?
Some organizations have achieved that, yes. And that little simple barcode scan, just like you see in a grocery store, knows exactly what the product is, who manufactured it, and what patient that product is being given to. Not every organization in the healthcare system has that barcoded data infrastructure, because what's important is you not only know what that product is on that surgical tray, you know which patient received that product. It's when you bring product data together with patient level data, that's where the magic happens. If there's a recall on that product because of a safety issue, they know exactly which Canadians are now at risk, and they contact and they support them so that they mitigate those risks.
Now, that doctor
Yeah.
who had to run to go get the equipment, why is it that hospitals don't necessarily know what they have on hand and that it's not on the shelves near the OR?
So it depends on the digital infrastructure. If that digital infrastructure is manual, meaning we just have forms and contracts of what we ordered from who, but there's no database that says, yes, we have 72 of those syringes and we have 85 surgeries who need them. Therefore, we need to find the extra that we're going to be short of. So it's the digital infrastructure that has the transparency of the data that has to happen in every organization who uses the products. Some have it, but the majority do not. They deliver those products on the shelf in the operating room. Anne Snowdon, the nurse, goes to the shelf, picks off the things she knows. Nobody knows I picked off 3 of those, 5 of those, or 17. And Anne Snowdon wouldn't necessarily know what shelf are they on. There are lots of examples where supplies get put away in some cupboard or shelf or something, and no one knows where they are.
Oh dear.
So clinicians
Oh, dear.
look all over the place. Oh dear. So how could the supply chain team know what nurses are using or not? Because there's no record of it.
And it's so anachronistic. If they can do it for grocery stores, why not healthcare?
Yeah, I don't know why not healthcare, because it costs a lot of money when you're buying products that are medical products are expensive, but you don't know where they are once they've been delivered. So how do we fix it? We strengthen and invest in our digital infrastructure. We mandate as a country that every product must be tracked with a standard product identification, so that this pencil has a unique product identification. And we know exactly not just who manufactured it, who distributed it, who delivered it, and who used it in a patient care procedure, like what nurse and what patient. The technology is not the problem. The technology is there. It's been there for decades. I've done 3 case studies years ago, before COVID, that documented when you invest, there's a 4-to-1 return on that investment. Meaning if you spend $1 million on a hospital tracking that product right to a patient, guess what? You get a minimum of $4 million in savings, because you're no longer ordering products you don't need and you don't use, called waste. So it is actually a very economically sound strategy. You just need the policies and the decision makers to get behind it to say, let's make it happen.
Now, we're doing this podcast with the Canadian Institute for Health Information. Yes. What would be the role of an existing group like CIHI?
CIHI has an incredibly important role, and I've shared it with the CIHI team. CIHI knows how many patients were seen, what surgeries were delivered, and what some of those outcomes are. They know that. They don't know what role the products used or back ordered or not available perhaps led to very specific outcomes. And that's the missing piece for them.
So you're talking about somehow in this Canada First strategy is adding more data from the hospital about these devices and products added to the data that goes to CIHI so you can get more information.
100%.
So that's a big ask, isn't it?
But if you had the policy frameworks that required it, does Canada want to advance and strengthen the quality and safety of health systems so that we can tolerate these global disruptions in supply? The only way you can effectively do that, like anything in healthcare, is have the data to drive decisions and the policy frameworks to require that data be reported. The data exists, but if you don't ask for it, you don't get it.
If managing the flow and the supply of these medical supplies is important, what about promoting Canadian?
Built here, bought here. Yep.
You're trying to also figure out a way to help health systems buy more Canadian.
So we have Canadian companies with exceptional quality products, in many cases that exceed the quality of globally available products. But my findings to date has been our procurement teams, the teams that buy these products, don't know if Canadian companies exist or not. And they don't really have a way to know that. When I ask them, how do you find companies that make products that you need? How do you do that? They said, well, we go to Google. Well, Google has built-in algorithms that are paid for by global national companies that say, hey, we're the best, buy ours. So they do. So it's finding and understanding what Canadian companies are out there and what products do they make, and how do we make sure most provincial policies are now moving towards buy Canada first. But that assumes you know where those products are and what companies are making them, and we don't.
And that's where your test website came up, where you set up something and you populated it with companies registered to sell medical products in Canada. How many are in the list, roughly?
So there's roughly 5,000 products, I believe it's 5,000, that are approved by Health Canada. So all we did was put it into a searchable platform so that any procurement team, any organization could go into the platform and say, which company makes IV tubing in Canada? And it will populate and give you in about 3 seconds a list of Canadian companies that make either the parts or the tubing that you're looking for. And it just simply says, here are the following companies, their addresses, and how to contact them. It's pretty simple, actually.
And what did you find? You asked for feedback from the health systems. What did you find?
So I tested it in a number of provincial agencies and teams that look for and procure products. And every one of them shared, we didn't know these companies existed. They don't show up on Google. No kidding. So they were surprised, and they were also thrilled to be able to find Canadian companies, because there's two reasons that's important. One is I don't have to worry about cross-border anything. They're more local, which means I can get my hands on those products faster. And the second part of that is if we support Canadian companies and they grow, that means more jobs and more economic value for Canada. And that's very much this Canada First objective that I think every Canadian is behind.
So health team leaders who are listening to this, how do they find this website? Is it up and running?
It's simply a link that we will be, now that we have just finished testing. It is managed by NGen, which is one of the Canadian superclusters that was funded by Industry Canada. So it's publicly available. I will be disseminating widely to every health system in the country.
It does raise a question, because I've seen over the years that hospitals and health systems have moved from local suppliers to big multinational ones with free trade. They offer more products, cheaper. And what the hospitals do is lock in for these really long contracts, 5-6 years, that Canadian companies can't really compete with. So you've got the economic side saying, hey, buy Canadian, but you've got the financial pressures on hospitals that look for what costs the least so we can get the most of it and fit the budget. Those two are not aligned.
It can't be all global national, all coming from one jurisdiction, because they gave us 2 cents per item cheaper than anyone else did. That cost has always been the dominant factor. It is no longer the dominant factor. It is, how secure is that supply? Are there Canadian alternatives? Are there combinations of suppliers we need to be looking at? Those are the critical components that need a much more balanced approach to suppliers and who can provide the capacity we need and offer us the assurances and the confidence in that supply. So it's no longer lowest cost. Cost is always one factor. Now it is much more, how do we become more resilient? How do we get over that fragility that we've all had to experience for far too long?
You're very passionate about this. You're
Yes.
also an academic.
Yes.
And between you and this idea are provincial governments that run healthcare and a federal government which is very occupied with other things. Like,
Right, right.
who do you want to make this happen?
The first answer to that is, does every decision maker, federally, provincials, territories, do they fully understand the impact of the decisions we're making when we procure products globally? That's number one. If you don't understand that Canada today has no idea what products we have, where we have them, and who needs them, that's a political lack of knowledge. They're starting to figure that out given what we've just been through in COVID. How this needs to be managed and who needs to take this on, from the partners, over 100 of them in my community of practice, all suggest a federal government group or agency has the ability to reach across all of the provinces and territories, engage not just the decision makers in governments, the clinicians, and the suppliers that know exactly who makes those products and where they can get them. They all need to come to this table. For heaven's sakes, put those pieces in place today that can anticipate these events or whatever the challenges might be, and have a plan that everyone can get behind and make sure that every Canadian gets the care they need when they need it. I'm an academic, but I'm actually a nurse first. I know exactly what that means when that patient cannot get the chemotherapy they need for their child's leukemia. It's just as awful for that surgeon who says, I can't do this surgery. I'm sorry, I don't have that product.
Are you hearing that change is happening?
So I'm leading this community of practice, Avis. I have multiple federal agencies and government officials on it. I have provinces and territories and clinician leaders and the companies that provide and supply or distribute these products and the procurement teams that need help. So it's a big agenda. As somebody said, Avis, it's not an innovation, Anne, it's a revolution. Yeah, maybe. But we have lived the devastating impact when it doesn't work in COVID. And this is a great timing and an opportunity with a Canada First mindset that, quite frankly, I haven't seen in 30 years. But it's not fast, it's not easy, and it's probably going to take some resource investment. But the other side of the coin is, look at the resources it could potentially save if we're no longer buying products that don't work, we can't find, and get thrown out because they sat in a stockpile for 5 years and no one knew where to find them. So I would say this is the time.
And if someone listening wants to join the revolution, well, using your word, what do they do?
You're right.
What's the fastest way for
Yeah.
someone to line up with the efforts that you've got underway?
There's anytime, anywhere, we are more than keen to have all stakeholders at the table.
It's funny, as I'm listening to you, it's almost like the trade wars have been a beneficial element in that it's hiked up
Yeah.
the concern.
Yeah, exactly. Never waste a crisis, ever. And perhaps this is the opportunity for Canada to maybe be the first jurisdiction in the world to pull this off.
Would this be the first in the world system that you're proposing?
Based on, probably 30 countries I have looked at, I can find no country in the world that can track the product from who manufactured it right to a person and the outcome they achieved. If Canada achieved that, yes, I believe we would be the first in the world, because I can find nobody that's actually setting out to achieve that goal.
Anne, a real pleasure talking to you.
Absolutely.
All right. Thank you, Anne.
Thank you so much.
Thank you so much for joining us. And please subscribe to the Canadian Health Information Podcast on your favorite player. I'm Avis Favreau. Talk to you next time.